Program Governing Board. Today it's 10 o'clock. We're at Turquoise Lodge Hospital, and I want to really appreciate Sean, all the team here, getting the room set up and doing all the work that they did. Probably the snacks. I don't know, maybe they'll eat for lunch today too. One sandwich or something like that?
Something like that.
Something like that. All right. And after I go around the room and establish a quorum, I'll do some introductions. So, and one, I think Retta will be coming in a few minutes, I'm not sure. So let me start over here with Angela.
My name is Angela Solis. I'm with Department of Health, Office of the Secretary.
Marie Casito, Department of Health, Office of the Secretary.
I'm Bill Shelby, Chief Nursing Officer with the Department of Health.
Gino Rinaldi, Cabinet Secretary for the Department of Aging and Long-Term Services.
Mitchell Lawrence, I'm the Program Manager for the Healthcare Coordination for the Department of Veteran Services.
Troy Jones, NMDOH Administrator.
Drew Rebel Chavez, the ASD.
Johnny Romo, Budget Director, Department of Health.
Tanya, I am a nursing student right to BSN. Just going to sit in.
Welcome.
David Lucero, LLCP Deputy Director.
Yeah, morning, David.
Donna Deason, New Mexico State Veterans Home Assistant Administrator.
Carmela Sandoval, Sequoia Adolescent Treatment Center Administrator.
Shauna Hartley, Turquoise Lodge Administrator.
Jose Rolla, Medical Staff Credentialer.
Jamie Davies, New Mexico Rehab Center.
Helen West, Administrator of Los Alamos.
Kim Polanco, Finance Director for Fort Bear Medical Center, Department of Health. I'm here for Kathleen Lucia.
Great.
Steve Norman, Chief Medical Officer, Department of Health.
Jeremy Avarella, DOH Chief Facilities Officer.
Okay, I'm Brad McGrath, Chief Deputy Secretary of the Department of Health. And we've established a quorum. I appreciate people being here. Thank you, Mitchell. Why don't you tell people a little bit about your background?
Basically, within the Department of Veteran Services, we have my office basically oversees any alliances with the state, the VA, any type of private vet, healthcare organizations. Basically, individuals that stand up and want to provide either behavioral health, situations with TBI, any of the situations that are that the veterans are facing. I kind of my office kind of coordinates that healthcare piece, making sure that I link the veterans to all of these either profit, nonprofit organizations,
right,
and basically link those services to the veterans.
Are you familiar? You probably are with our Veterans Home and the Consequences?
Yes.
Been there?
Yes.
Okay. Yeah, we're always looking for business.
Trust me, as the veteran population ages, there'll be some more individuals going that way. So.
Good. Thank you for being here today. Well, I mean, we always do the first order of business to approve the agenda, which is usually the same agenda. The agenda today, as in past meetings, is in a moment we're going to look at the minutes from the old meetings. We're going to do a quick report from up here and then all the administrative reports. And probably we'll go into closed session. After we do that, the policies, credentialing, we'll go into closed session and come back in open session and adjourn the meeting today. So, yeah, the first order of business, got a motion to approve the agenda.
So moved.
That's usually not too controversial.
Second line.
Okay, all in favor, thank you.
Aye.
All right, there we go. Okay, now the minutes, starting in the next pages, you'll see several pages from January 15th. So you'll see in the minutes, the administrative reports, the financial information behind that, going up to see how it goes. A lot of pages. I'll go to April. Okay. Probably around. Let's get the page under there, but let's see.
After the financial, we'll just write it down.
Financial report.
The program area 6.
And get through there, you'll be at the administrator's report for New Mexico Behavioral Health Institute, which will be the first administrative report we'll do in a couple of minutes. They got about 30 pages or so. I'm sure you're reading them all. And these are all the reports from January from the administrators and finance and credentialing and Minutes from our last meeting, January 15th. So if I could, ask for a motion to approve minutes of previous meetings.
So moved.
Second. All in favor?
Aye.
Approved unanimously. Now we'll go to new business reports, which will be a little more interesting than we just did. We always start, I don't know why, Troy, we always start with New Mexico Behavioral Health Institute. So let's just start today.
That's good. Good morning, everyone. I don't have a page number on this, but it's right after the end of the minutes if you want to follow along. First piece we go over is the statistics by division for the last quarter. Our adult psychiatric division had 174 admissions, 175 discharges, and their average census was about 78. On our care unit, we're pushing admissions on that unit to get them to 12, to stay at 12. We had 4 admissions, 1 discharge. We're averaging 9 now, which is up by about 2 from last quarter. Forensics, we had 21 admissions, 30 discharges, and we're averaging about 50 individuals. Our 1.5 population is around 38. Out in our outpatient program, we had 91 admissions, and we're currently running at close to 1,300 active outpatients. On our nursing home, we pretty much almost doubled our admissions to our nursing home from 11 the previous quarter to 21 this last quarter. Unfortunately, we had 16 discharges on top of that, 11 of which were people passing away. It put our average daily census at 146. Under projects, we had an active quarter in regards to some declarations of emergencies. With snow and rain, we actually had some roofs that were leaking at our forensic division, which caused some difficulties in moving individuals around to maintain that secure population. We had some mold remediation restoration that came out as a result of that, those water leaks. We also had what we call our drive-through or drive-in, where an individual drove into our admissions building through the doors at about 1:45 in the morning. So as a result of that, the roofs have been patched at forensics as part of the declaration of emergency. The remediation and restoration, we're working on trying to identify monies through FMD and Mike Brown to get that done. And the entrance doors, the risk management is going to cover that, and it's going to be a tab of about $15,000. They were waiting on the police report, which they got yesterday, so we're hoping that that can actually be redone in a fairly quickly manner.
Did you admit it?
Did not. The police admitted it into the detention center. As a result of those DOEs that we had in the population that we had to take care of in forensics, we were looking at, because we started doubling people up in rooms, and with the gang affiliations and violence that can happen on the forensics division, it wasn't a real safe environment. So what we did is have to identify some safe space that would be secure and meet the requirements of the statute, but at the same time be able to move some individuals around. As a result, our STOP program, our adult sex offender program, we put a moratorium on admissions. It's the only other buildings on our campus that actually has the Carcentina wire and a secure environment. We did the moratorium on admissions, and through the discharge process, when they completed the program, freed up that space of the Crestone building so we could move individuals into there to make sure that we had a safe environment. The rest of these are just capital projects and kind of where we're at. I know we had a meeting last week with General Services Division, FMD, regarding some of our projects. Our roof replacement, when they started doing our cottages for the HVAC systems and the roof replacements, they got in there and there was significant amounts of mold in the two buildings they started with, which we had expected that. Patients and staff had been moved out of there years ago, or a year ago. And as a result of their remediation, they've actually removed so much of the building structure that now everything has to be up to the new code and couldn't be grandfathered in. And so we're waiting on an electrical upgrade quote. Out of that dollar figure that we had for 6 cottages, we're probably going to be able to get 3 cottages done. One of those cottages we're waiting on, so I can then do the bottom bullet there is the Tasuki and Isleta boiler replacement project. We got $1.9 million for that. But I'm going to need to one of the cottages to move patients to while they work on one of the units, and then just keep moving patients around while we're doing one section at a time. So that kind of got put on a hold, and we talked to Mike about that money for the boiler replacement. If we do not get any extra capital money or no special session this year, that may be something we might want to, we're going to put it out to get the drawings done, put it out to bid, but then hold on to the money to complete that in case there's emergencies throughout the OH that we need to use some of that fund.
We're at the meeting this afternoon, the facility meeting. Michael Brown will be here.
Okay.
So he can talk to him, and he's going to go over all the projects.
Okay, our campus security, just real quick, is one of the things we've been trying to get done for 8-9 years, and we're finally to the point where we have cameras in a large majority of our buildings. Patient care areas, Tasuki Isleta, our adolescent unit, forensics are all completed. Now we're waiting on dietary, turquoise, gym, and La Posada. When that's done, then we're going to move to putting cameras in the parking lots if there's any remaining funds that we have left. Then I know Mike will probably talk more about the demolition of the old Meadows building. That RFP was projected to be out mid-April. It looks like that's going to probably be pushed back to May because it's a new process they do for the RFPs through GSD. So July or so, we should have somebody assigned to that. It's going to take about 7 months to demolish and build back up the foundation. In regards to our personnel side, we actually more than doubled in the number of positions we filled. We filled 112 positions last quarter. We did have some significant loss. Dr. Olivares resigned as our chief of medicine and our medical director of long-term care. We have a neurologist that recently has come on board, been there less than a year. She took over that position. She's doing an amazing job. She's an incredible individual. And she did apply for the FTE position for that. I have that in HRB waiting on final approval so we can, in fact, I think it was April 25th is her start date. I saw that yesterday. So she's going to be our chief of medicine. We had a psychologist, we call her Dr. Desi because I can't pronounce her last name, Tsortsis. She resigned and moved to, I think, California, and she was also our medical staff president. So Dr. Russell, we had an emergency election, and he was elected as our new president. One of our medical physicians, Dr. Cuervo, he's looking at retiring in May, but we did hire 2 additional psychologists, Dr. Merkel and Dr. Gujon. One for the adult psych division and one for forensics. And we had a letter of resignation from our nursing home administrator, Sharon Inouye, who will be leaving. Her last day is April 24th. We're going to have Bill coming up to help us out. He's already been up there doing some stuff to make sure that transition is smooth while we get the position refilled.
Right. Now, Bill, we're lucky with Bill. Bill Chaudhry, in addition to being our CNO, also has a long-term care administrator license.
And he's not familiar with our organization at all, so we'll have to do some orientation. He was our previous administrator of our nursing home, so we feel very fortunate to have Bill coming out to help us out. Right. And just a few little miscellaneous bullets there. Our nursing home long-term care division is in our survey window for our annual CMS survey. Our adolescent sex offender program, also known as a CARE division, underwent its annual CYFD certification. There is actually a good survey, no deficiencies in our physical environment, life safety, personnel, and training files. We did have some opportunities for improvement in regards to some treatment planning areas and documentation, but we have a corrective action plan in place. We're just waiting on the report to come back from CYFD so we can respond to it. The pharmacy is very proud of a punch card distributive access system that they put in place at long-term care, and our Crestone units. And the preliminary data showing that there's actually been a reduction in our medication areas related to that process change. We're looking at trying to see if we can't develop that throughout the entire facility. Okay. As you guys know, we continue to meet weekly with our 4 managed care organizations and Optum Health. We were successful in getting our United contract amendment in place, and I appreciate management or administration for helping us with that and getting that signed. Because there's significant amounts of revenues we have billed for that we're hoping to collect now as a result of that amendment to that contract. They were not paying for our adolescent program or our adult psychiatric program. And so now that amendment is going to allow for that to happen.
Right. Okay. So, any questions? Sure.
Troy, on the MCOs, how's that relationship coming along now that it's been a year and a little bit everybody kind of getting on track? Is it going smoothly?
I think a lot of the bumps have been worked out, but there's still issues that come up in regards. I mean, we're still having issues with the United contract in regards to receiving monies from like public health and other areas that are going into our receivables, into our actual share system. There's about $167,000 in there now that was inappropriately paid to us. It needs to be paid back. We're trying to get $1 figure instead of cutting. They want to check. They don't want to just take it out of future payments, and so it's more difficult to write a check in state government than it is to do that. So we're wanting to try to get that number in one ball so we can pay them back. But there's glitches like that. They've been fairly receptive in regards to our weekly phone calls. I think that was a good idea for us to put in place. To have them, we have also representation from ASD that are on those calls, I believe. With that, Optum Health has been an interesting one that still deals with our indigent contract. And having some more bumps in the road than I expected, given that they were already in place and understood us. But we're working those out, and they understand when they do owe us money, and we have been getting that back.
Good.
There's a lot of persistence
Yeah.
with those.
Big number.
All right, thank you. Sequoia Adolescent Treatment Center, Carmela.
Hi. From our last report, last governing body, we've completed our Lodge D renovations for making it a more welcoming environment for the residents. It seems to be holding up with the boys on the unit, so we moved to Lodge D. We also ordered a different type of furniture and had a few months to evaluate if it was going to be durable enough for the type of residents that we serve, and the facility or the Building Bridges Committee voted on ordering that type of furniture for the other lodges, and it has sustained its use for the 3 months and has not been destroyed. So we're happy to see that. We've also started the initiative of replacing the old locks that we've had indoors, and the last project that we're working on is the HVAC system and the administrative side, where it holds education and the medical wing of our facility. It's used its life, and so we're working with GSD on that component and Max as well.
You're trying to really go from being that correction type
Yes.
look to a therapeutic look.
Right, and it seems to be with our several visits that we've had from different members of the community, it seems to me that it's really welcoming. They like our education program. A lot of feedback that we've gotten from the community is that they're not expecting to see the school that they're seeing. That's actually a school. So we've gotten a lot of positive feedback from the community. We're doing tours quite often now, so it's great.
We do.
We just recently went through our survey from CYFD licensing and certification, which we had, as well as with Dr. Jones's facility, we had 0 deficiencies in our HR records or our environment of care. We have some areas for improvement in regards to treatment planning and documentation. One of the things that needs to be noted is that they're recommending 18-month certification for Sequoia. That hasn't happened in a lot of years, several years. So, and we've also just received our report as well, and we've already worked on our corrective action.
Yeah, that's really exciting.
We also had our annual fire marshal inspection, and they noted 4 deficiencies, which we all corrected on site. So we passed that inspection. Vacancies, we have 13 current vacancies at a 13% rate, and we're successful in hiring Dr. Durham. Dr. Sabani, our contract psychiatrist, is leaving May 15th. So we're replacing our contract with a full-time psychiatrist. We hired a nurse and several technicians.
Dr. Durham's a really good doctor these days.
Right.
Got an extroverted personality, good doctor.
Right. We are improving on our collection rate, which we're at 80% for this 3rd quarter. And due to Dr. Durham's successful hire, we're lowering our contract costs quite significantly, so we won't have no psychiatric contracts at all after this last hire.
Right.
Continuing on our training efforts, we've done trainings every month, it seems like, from trauma-informed perspectives. We're going to host on the 27th and 28th, the Building Bridges 6 core principles, and we'll also have the 29 and 30 where all 100% of our milieu staff will get tailored training just for the milieu staff on the 29th and 30th, and that will wrap up the Building Bridges core principles where all our staff 100% will have been trained by that point. We've also opened up our training to UNM, which they've been in attendance. They've sent, we opened up 20 seats and they're sending about 15 people from UNM, and they attend our training in all 12 our sister facilities. That's it.
Well, that's great. In fact, your vacancies are very low, which is great. And I know with the medical services, you're in pretty good shape. And it sounds like you've got a good team there for providing services. And we'll talk later today. I know in our facility meeting, you're really made a great turnaround there in your financials as well. So you're having a really good year. Any questions for Carmela? Okay. And Sean, our hostess, thanks again for being here today.
Yeah.
Sure, go ahead. Sure.
I mean, in lieu of our new Veterans Health Representative, do you guys get veterans that come to your door?
That's Sequoia?
Yeah.
We serve adolescents.
Oh, adolescents.
Yes.
Sorry.
No, yeah, sure.
But potential veterans.
Yeah, future veterans. But yeah, some of our programs do.
We'll do that.
Absolutely. Yeah, we'll pick on Sean. We'll ask you that question then.
So in the last quarter, our adult detox rehab program, we did 176 admissions and 159 discharges. With our adolescent program, in the last quarter, we have had 36 admissions and 34 discharges. In our MO2 program, which is a program that runs 7 days a week from 8 o'clock in the morning until 8 o'clock at night, we've seen 858 patients for social detox purposes. In this report, I wanted to highlight our school, which we are a satellite school connected to Sequoia. We started our school in September 1st of 2014, and we have high school services for grades 9 through 12. The customer that we're servicing, now that we have more data, the youth have traditionally not been attending school for approximately the last 1 to 2 years. Approximately 25% of our students admitted into our program are electing to do GED versus participate in our high school. And we are able to provide them with language arts, social studies, math, science, and we have a couple of electives. When a student is admitted into our school, they actually, if they participate in our high school, they can actually receive a transfer grade at the end of 30 days, which is pretty remarkable. In the last quarter, we have purchased 10 computers so that the youth can participate in an educational lab. We've also been successful in hiring an educational assistant, Matt, who just most recently graduated from New Mexico Tech University and has a really strong background in science and math. We're in the process of organizing a small library, so if you guys have any books that you want to donate, we're definitely open to that. And I just wanted to thank Carmela for participating in this collaboration, because I wouldn't have been able to do this without her assistance.
That's a huge plus here, to get that in place.
So thank you. In the past 90 days, our facility and Bernalillo County has made a strong commitment to begin a collaboration where we've actually been meeting every single week to improve the services that we're providing in MO2. For those of you that don't know what MO2 is, it's a harm reduction program for individuals who are interested in socially detoxing. They're not necessarily interested in rehabilitation or not using, but they are interested in not using drugs or alcohol for a period of time. The folks who are admitted into this program are actually admitted into the county program, and they can stay in this county program for approximately 10 days if they want to. Traditionally, what we've done is the consumer comes through our door, we conduct an assessment on them, and we were providing medications for approximately 3 days. The challenge with that was that sometimes when we were prescribing this medication, the clients were having side effects. They were having some issues on their side. They might have had some type of infection that needed to get looked at again. And so what we've moved to, which has been a tremendous feat, I think, on both of our systems, is that we're actually doing daily dosing. So that forces the consumer to actually come back to our facility for each dose. At that opportunity, they're re-looked at by our medical provider, and then any other follow-up issues can be addressed at that time. What has happened since we began to do this is that the med errors in the MAX program has actually decreased. According to our last meeting last week, their medication errors are below 7%, which has been the best that they've had since they've begun the program. And so I think that we're providing much better services for the MO2 clients, in addition to assisting the MAX program and improving their medication errors. In the last quarter, what we've done here at Turquoise is that because of the clientele that we service, there's always the risk of these folks bringing in contraband into our facility. We service folks who have substance abuse issues, and that was something that we wanted to make a conscious effort to address. So we put together a safety committee, and what we decided to do is actually look at what was being brought into our facility versus after the fact. What we did is that we came up with a new patient belongings list of what people can actually have in our facility. We actually made a key for my staff so that they are capable of looking at every single item that comes through our doors. The committee consisted of leadership team, but also my direct care staff, and we elicited consumer feedback as well. With this new system, the consumers actually have a choice as to what they get to bring into the facility, and everything that is over the amount that they're supposed to have goes into a storage shed, and they're not able to access it until they're discharged. We've also established a new drop-off procedure because there's a lot of folks who come in our facility who don't have enough stuff when they get here, and people are kind of randomly dropping things off. We were tending to impulsively giving that to the consumer, but there's always a risk of contraband in those states. So now we have a drop-off system where everything again is searched, and since then we've had a huge decrease in contraband that's been coming through our facility. So that's been a really positive thing. In the last quarter, we've also established a relationship with the UNM Pediatrics Department. And so what happens once a month for approximately 3 to 5 hours, we have a resident that comes to our adolescent program, and he or she actually facilitates a group or participates in our program or just does simple observation in hopes of trying to educate these folks who are going to be doctors in substance abuse treatment. Once that person has done the observation, myself and Dr. Lipkin, who have had the pleasure of working on and off in my career for many years, sit down and actually answer questions for the doctor. So he's reported that that's been actually something that's been really helpful.
Is that something, Carmel, that can be done in Sequoia too?
Yes.
UNM Pediatrics do that?
Yes, yeah, we could do that too.
You just selectively do that?
I think our relationship with the University of New Mexico is getting tighter and tighter as we go along, and we offer them opportunities for non-traditional types of training, and they're very receptive to it. And I've been, we've been involved in talking about the residency rotation.
Oh, that's fantastic.
There's certainly no barrier since we've got our contracts in place to have them rotation at Sequoia and other places too. So.
Yeah, and Sequoia, maybe they would benefit from that as well. That might be good. We're also working closely at Sequoia with Dr. Mauricio Toman, the chair of psychiatry at UNM. So we were just on the phone with him the other day. So these are relationships we really want to grow and build. So it's very good. I guess you got some hiring successes there. You got this.
Yes, we've hired a supervisor for my adult rehab program, Brian Kimber, who's worked for the department for many, many years. Is a very skilled clinician. We've been successful in hiring a registered nurse, one nurse aide, a physician assistant full-time. Her name is Susan Bear-Bleckley. A medical secretary, 7 psych techs, and 1 recreational therapist. And we have currently 11 vacancies.
No, that's very low also. Very, very low. That's very, very good. Yeah, we always remind people, we might be sharing this property with the county, but this is a statewide program, so your stats show you get patients from all over the state of New Mexico. Adult and adolescent. So thank you very much. Are there any questions for Shauna today?
We do. I would say it's a low percentage, probably less than 5%. We tend to have more veterans in the summertime than we do the wintertime. We were looking at the data of that a couple of months ago. But we do.
They're transitory or are they coming to visit?
And Shauna, can you do tours for anybody that's interested after the meeting today?
Absolutely.
I think there's 3 people. Anybody want a tour? Okay. David, Reed, and Angela want a tour today?
Angela.
Oh, you already got one? Okay, great. Right. Well, 1 person. 1 more. 2, 3. Okay. All right, so you need to pick up lunch for us.
We promise not to keep you.
All right, thanks. And John, the Los Community Program Administrator Report.
Thank you, Brad. At present time, Los Lunas, we are serving 79 individuals. Of that, a little over half are Jackson consumers. We sit at, I believe that the number is 41 at the present time Jackson individuals served. Application is on file with the for our Commission on Accreditation and Rehab Facilities survey. Our anticipated, we went with that early April submission based on CARF's recommendation on when to file for that.
Let me ask just on that. I mean, that's pretty significant. Now, I guess, Dr. Dorman, in my career, up to here, I've never had CARF accreditation, but they're very similar to Joint Commission.
Very similar, yeah.
Very similar to 2 or 3 day survey, or?
Well, we expect, since this will be where Los Lunas was accredited roughly a decade ago when the accreditation was dropped, so we'll be entering into this as a newly accredited provider, which will probably give us an extra surveyor and an extra day. We anticipate up to 4 surveyors for roughly 3 days. Part of that reasoning is, as an initial survey, all of our residential sites have to be directly surveyed, so all 26, 27 of our residences. So that is going to add some time to it. What we have been working on this last quarter related to CARF and the accreditation process is we've renewed, placed a great emphasis on our community inclusion and employment programs, and it's been identified from a consultant review that we really needed to enhance personnel-wise related to those programs, mostly at the top end in terms of the overall management and expertise related to that program. So we're looking at that now with HRB and their assistance to do that on some positions. Also, one major area for CARF this time around was something called cultural competency, both for staff and for all the consumers that we work with. And our finalizing residential leases, we have 2 new leases that are going into effect. One of those relates to the next item that I have listed, which is intermediate care facility that we are developing at present for female consumers, which we have for males at present. We're attempting to do that for 4 individuals on the female side on the referrals that we receive, and that should be, I think we are in about a 3-month window to get that up and rolling. So, and that is a new revenue stream that is finalized for us, which is a real plus for Los Lunas. The one scheduling thing we're trying to avoid in July, community practice review related to the Jackson litigation is occurring, I believe it's the week of July 9th. That will involve roughly 15 to 16 of our individuals who we serve, fairly intense for a week or 2. So we have asked the CARF offices to avoid understanding with the city of Belen and also with state public health, coordinate community inclusion opportunities for our population, which is the developmentally disabled. One aspect of that will allow us to access Belen Eagle Community Center to let us both have classes and programs developed for our individuals with the community at large to try to integrate those two groups. So we're excited about that program. Dental clinic that we have oversight for, they are presently upgrading, replacing current electronic hardware that at present it's starting to impact their ability to store and retrieve client records. So we are upgrading that system with them. Side note with that, the additional space in the dental clinic in Albuquerque that is occupied by the seating clinic, the Developmental Disability Supports Division. I think there's been some action that Deputy Secretary Gallagher has been involved with on the possibility of seating clinic making a move to expand the dental clinic for that second dental team. So didn't get that in
Mike Brown will head up that group.
And Michael Brown, yes, thank you for that with that. The actually for us, it's a fairly large thing. We're finally getting a newsletter, monthly newsletter developed for Los Lunas community program, both for the general public and internal. That should be coming out 1st of May. And we presently are working still with the Department of Corrections on lease space on the old Los Lunas Training Center campus. Two issues. One, they are looking at some expansion. Second issue has been some payment schedules that run back into the last FY year. That was some increased lease costs and the payments were not matching up with the new lease, so we're doing some recoupments there and trying to make sure that 2015 lease that's in effect is identified with enough figures and we can get that reimbursement flowing since it has been slow. And we are working with DVSD at present time on getting some individuals approved for waiver services via disabilities waiver. That came to a bit of a halt with Jackson injunction related to supports and density scale, which is really the identified funding mechanism for our individuals. So we're working through on that. We have a total of 26 leases at present time residentially. 2 are new leases, and one of those is the ICF location. And we continue to place major emphasis on our payroll overtime costs related to our payrolls. Basically, we have, since January 3rd, that's been a major point of emphasis for us. Personnel-wise, we've had 4 new employee orientations in the last quarter. A total of 15 new hires for the quarter. Hires of note with the Director of Nursing, our Quality Assurance Nursing position, and our Finance Manager. Quality Assurance Nurse, in addition to being an RN, she's also a Physician's Assistant, which is credential-wise has helped us significantly there. And I'd like to say thank you both to working with some of the other facilities, with NMDOH and with Sequoia on some position exchanges that have helped us out significantly. So thank you for that. Our vacancy rate personnel-wise, depending on the day, is running roughly 8 to right about 9.25% vacancy rate on personnel. And we will be related to that. Workforce Solutions has a May job fair schedule that we will be participating in with that. And one of the issues, we have formalized our agreement with local law enforcement, which they have accessed the campus in the past for canine training, and now we have a formalized agreement with them for that, which we haven't had in the past. So we're cleaning up some of those type of things.
census, again, your census is good, and your vacancies are very low. I know the last couple of quarters, your census has been, your vacancies have been very low, so it's really been great. Capital Sarah's been a great HR director for us. Any questions at all?
John, I have a question about the new ICF residence for females. It's anticipated opening in 3 months. What's the anticipated revenue stream from that over a year?
Well, there's going to be a timeline that we need to provide the service to get the rate developed, and then we will have basically they'll identify our costs related to that program, and then we will get an individual rate per individual. We've been running some figures varying from 40 to about 80,000, between 40 and 80.
Who is that? Who pays it? Who pays it?
Is that per individual or
No,
as a whole?
no, that's as a four-person group.
Okay. Well, that's good to see how that works. Okay, thank you very much. Donna Deason, you're here today from the New Mexico State Veterans Home.
Good morning, everyone. At the New Mexico State Veterans Home, we'd like to share a report with you. For this last quarter, we've averaged 120 for the quarter for our census. January was 121, February 119, and March 121. Our project constructions are, we have an RFP was awarded to the Sunk Construction Company for our new Alzheimer's building that will be on our campus. Contracts from the state of New Mexico need to be in 90 days from the VA deadline of March 24th, 2015. We're hoping to have a
Yeah,
state in the
I
whole
was
of
gonna say,
July
I don't know if you know Mitchell Lawrence here today.
Yes,
You know,
nice to meet you,
veterans.
sir.
So, have you had a chance to, you said, tour our facility down there?
I didn't really tour down. I recently helped an individual that got down and lived down there, and so I just went down there just to say hello. He was a World War II veteran, so.
Oh, wow, really?
So down to make sure.
Wow, World War II.
Yeah.
Wow. That's amazing. And, well, you're welcome to take a tour there anytime.
Yes, you're very welcome. Okay, personnel matters. We hired this quarter in January 5, February 6, and March we had 2. Survey and regulatory notices. Department head staff are devoting their time to completion of items outlined in the Joint Commission mock survey we had earlier this year, January 27th and 28th, and completion of the directives on the OFM survey project, as well as preparing for upcoming surveys. We're in the window for CMS since February until September, and the VA window is a 2-week period in August, and Joint Commission September of 2016. Tobacco-free campus. The governing board is hereby formally notified that the New Mexico State Veterans Home is rescinding its policies on being a tobacco-free campus per Office of Facility Management.
And I think the problems there, that World War II veteran has been smoking since like 60 years ago.
Miscellaneous announcements, the influenza vaccinations as of March 31st are at 169. Direct care staff are at 95%, and overall staff percentage is 94%. Thank you. Do you have any questions?
How about comment? We are currently going to have afternoon discussions with the VA Medical Center about provision of telepsychiatry services to the State Veterans Home. Admission of behavioral health patients has been one of our barriers in increasing census, and I've reached out to Cassandra Valdez and Dr. Don Geezy, who is Chief of Telepsychiatry over there. We've already made arrangements at the Veterans Home to have a location and teleservices developed by IT down there, and we're going to work out the details. The veterans who will receive these services, of course, have to be enrolled in our regional system to obtain care, but under the Choices program, that's going to be a tremendous boom. And they are bringing their services down to the Ben Archer Clinic in Truth or Consequences, so it might be an opportunity if they need to see somebody on site. So we think that will be a tremendous advantage to all parties. And we're just entering, today is our first meeting, but we think this is going to be up and running in a couple of weeks. Right. Unfortunately, it won't be available to the spouse residents at Veterans Home, but certainly the vets will be taken.
I'm really excited.
If I could just add to regarding the tobacco-free campus, there's been some long discussions around this. I know that for a very long time, the last couple of years, moving towards a tobacco-free campus. But as we analyzed kind of the differences before and talking to some veterans themselves, there is a prevalent population that still continue to smoke, and we didn't want to have that as a barrier for them to be able to be admitted for services when they need services. There are a few individuals that are grandfathered in that are currently at the facility, but this would open up that opportunity for individuals. They can still get smoking cessation, and those opportunities are still offered to them there, but it won't nix them from being admitted.
Dr. Gorman's going with you today to that program.
Dr. Ed Janetsko is coming up from Veterans Home. Greg DeMoore's coming up. We're having David McCullough, Lisa Lujan, and Bill Chalky and I are going to go over there. We're going to talk to them about what is our next steps. What it involves is defining a population who might need the services so they can get an idea of volume. But I think it's going to be a great boom because while the care there has been excellent, provided by Dr. Janetsko and Dr. DeMoore, this is a need that these residents have that the VA can provide because of the care. And it's just been a barrier to bring someone from Truth or Consequences up to Albuquerque. Right. And so it's going to be a good time.
It's great, fantastic.
Yeah, it was very easy to set up. They were immediately interested.
There's enthusiastic emails back to you.
Yeah.
So I'm glad somebody called, you know?
Yeah. Right?
Yes.
I have a question. I know last year we were talking about the building of new facilities.
Yeah, when we extend
that's
right.
Where are we with that?
That's the first phase that Donna touched on
Yes.
briefly there, the Alzheimer's.
We finally got through the federal grant and that was approved. The state signed off on everything, so everything is done timely. Talking to Mr. Brown, who is helping us out with this, it looks like we might start July 1st of this year, and that'll be on our actual campus on the east side of our campus, and that'll be a 39-bed Alzheimer's and a 20-bed skilled. And we're very much looking forward. Estimation is 18 months to build.
And it seems to me I also remember, maybe sometimes it makes the meetings. That's what we do a lot of this, Secretary. Is when we're not talking about other locations in the state, possibly having a facility.
Other veterans facility?
Yeah, or are we just looking at?
No, maybe Secretary Halman mentioned.
That's what I'm saying. I've had a lot of conversation with him, and then, but now.
There's never a shortage of veterans in it.
Yeah.
There's a lot of them out there. World War II, that's unique, though.
There's not that many left.
No. No. Okay. Let's see, any other questions? Veterans, okay. And Jamie's come up. Jane Davies from Roswell, and I'll let Janie go ahead and give the Roswell report.
Okay. For our medical rehab unit, we had 37 admissions for the quarter, 39 discharges with an average daily census of 5.9. On our chemical dependency unit, we had 79 admissions, 78 discharges, and an average daily census of 16.1. The rest of the statistics there show you how many outpatient and the only outpatient we're doing right now is physical therapy. We had 128 visits for the quarter. The others show our inpatient visits that for our medical rehab unit and then our doctors. For human resources, we had 3 hires for the quarter, which leaves us at a 13% vacancy rate.
I think you got, what, 12 jobs? 12 and a half jobs?
12 and a half jobs. Recruiting, we just hired an infection control nurse, which is good for us. We needed that expertise in the building, and we also hired a new CDU director who has some great enthusiasm and great ideas, which is helping us change the services that we're offering on our chemical dependency unit. We set for survey, joint mission survey, February 24th and 25th with the life safety survey following on March 5th.
Snowstorm then.
Yes, that's why there was a gap between the two, the two surveys. It's a validation of NMRC's continuous improvement efforts. and our commitment to meeting rigorous health standards. It shows how committed we are to improving and delivering safe, high-quality patient care.
We did really well there on the patient care. We've got some building issues when the building was built that they want us to address with doors and generators and
that
type of thing.
corrective action is in place. It'll be done by the 60-day mark for resurvey on that. For marketing, we still have staff that continue to go to hospitals in West Texas and throughout New Mexico for referrals on our medical rehab unit. We educate them on, the rigorous one-on-one therapy that we have, that they have to have 3 hours of therapy a day, and our goal is to rehab them to send them back home instead of a nursing home. We're working referrals on our chemical dependency unit, and that's going to increase with the hire of some counselors that we're looking at. For our medical rehab unit, we're still working on referrals. It's been challenging to get physicians to understand the difference in services between us and a nursing home setting. So we've been focusing on that. For our chemical dependency unit, we're still looking at filling 3 vacant counseling positions. I believe we filled 1 Monday, so we're down to 2.
Okay, that's good.
He started actually working the unit today.
Wow, fantastic.
He's through all of his
orientation?
Yeah, orientation and massive trainings and HIPAAs and all of that we have to do. And our big focus right now is our IOP program.
So let's talk a bit more about that so everybody understands what that is.
What, the IOP?
Yeah.
It's a 16-week program that's designed for rehab at home. They'll come into the center. It'll be a group. We're starting off right now. I think Monday we'll have 8 in the program, a maximum of 15 per group. They'll come in 3 days a week, 3 hours a day, and spend time in there. It'll help them I don't know, focus on their rehab in a real-time situation so that they're dealing with the triggers during the days that they come in that they met on their days that they weren't in the program. We expect some relapse. We'll drug test them in the program, but it's going to give them coping skills on how to deal with the triggers out in the community that they deal with every day versus our inpatient program, which is focused on treating them in the facility and then sending them back out there. We're going to start with a single group by the middle of May. We hope to have 2 groups up and functioning, and we'll go from there as we have counselors.
Right, and this has been our part, I think for one, but the Arizona provider, leaving Roswell in behavioral health, this is our contribution to that population to try to take on and do this program, which I think is in great collaboration with HSD.
Yeah, HSD and the MCOs have been wonderful in working with us on this. The contract, the amendments are in place. It's just been very exciting to see all of this start come Monday.
Right. That's real now, next Monday.
Yes. Well, we've got 8 admitted, so hopefully they'll all show up.
One of the other opportunities the other thing we're going to be discussing with the VA today when we go over there is veterans opportunities for IOP treatment, because there are none of those services around, none of the New Choices program, because they're so far away from the medical center.
Right.
This is another real opportunity to help the vets in New Mexico.
There are definitely some vets in our area there.
Oh, absolutely.
So we'll get benefit from that. Yeah, so thanks for doing that too.
Is there like a screening process to make sure that say a patient was going to be in your IOP program? Do they have to show certain abilities so that they're able to deal with what's happening out in the community and still have a good probability of success, or is it just they can decide whether they want to
We do a screening process on both the IOP and our inpatient. And based on the recommendation of the team, when the screening is done, is the recommendation on whether they go into the IOP or into the inpatient program. The IOP is going to be important for the people that are working, and because we'll end up having an evening class too. But it helps them deal with the triggers at the time. Versus the inpatient, like I said, we bring them in and we get them off the drugs and stuff, but they haven't really focused on what triggers them out there. So this will benefit the others.
A lot of our referrals come from other agencies.
Right. We get a lot of court-ordered and CYFD have been the referrals that we've dealt with this week for that program.
Right.
I have a question for you. I'm sorry if I missed this, but how will you know if it's working? How will you be measuring
The IOP program? Because it'll be full, we will monitor them just like we do the inpatients on their success rate once they're completed. Like I said, we expect them to have some relapses. Based on those relapses, it can extend the program past 16 weeks if they meet certain criteria.
Yeah, you never know for sure.
I'm just curious. Well, that would be good if you're getting paid. I just wonder about their recovery outcome.
People, we get return visits. I guess that's one thing we'll know. But
well, and that's why we started a call intake log too. We started the system in Avatar that I think we've got from Turquoise Lodge that we're going to do call intakes and monitor them through the system.
A lot of logistical stuff to get it going. We're talking about this summer possibility of, we have 4 beds that are designed for medical rehab instead of social rehab, so we're looking at the possibility of using those 4 beds as well, which should also support the IOP program.
Right.
So Roswell's looking at just trying to beef things up a little bit there and get a positive financial situation in these years, which I'm pretty confident you're going to do. You?
I mean, to take off of that, my assumption is that when you intake them and you determine this is the course, that you guys establish a care plan and all that stuff and deliverables and medical stuff. You want to do that. And then you also are looking at it from, I'm assuming from the fiscal standpoint.
Yeah.
It will be self-sustaining.
It will. Actually bringing hopefully to a maximum of about $50,000 a month. And that's just exactly what Roswell needs. 2 groups, to be positive there. And we do have a psychiatrist / internal medicine physician on site, and another one that's a family practitioner. So Dr. Black there has been a big help.
And so with the announcement of another behavioral health provider pulling out, and that will be in your neck of the woods, isn't it? The southern part, southwestern?
Southeast part.
Southeastern? Okay.
Yeah, southeastern down there.
That would be off road there, right?
Yeah, well, it's Turquoise Wellness, Health and Wellness. That was there.
That's the one in Roswell.
Yeah.
But there's another one.
In Grant County, there's one for Terra that they recently closed on bankruptcy.
Yeah. So are you thinking of possibly replicating?
I'll do an IOP up there. I don't know, it's a good question. I don't know if, I'm not sure if Fort Bay did do.
Well, we've kind of been looking at the demographics there. I mean, because to do an IOP, you have to be able to discharge them home and have a safe discharge there. Do we have enough, or is it too spread out? We're actually looking at the feasibility of which locales would be best served for those IOPs right now. It has come up at Fort Baird. That would be a discussion that we're continuing to have.
And if we can assist with the payment services, that will,
right.
As far as that, because sometimes these are our folks as well.
That's right. Yeah, it's an interesting experiment. We'll have to give a lot of feedback next time on how it's working in July. Okay, now Kim, you're here representing Veterans Homes.
We have Charles on the phone as
Or
well.
Kathleen on the phone?
I think so.
Okay. And anybody, Kathleen, are you on the phone?
Yes, I am.
Oh, okay. Well, Kathleen, Kim is here. And do you want Kim to read the report? Would you like to read the report?
I want Kim to do it only because it's kind of here.
Okay. All right. Well, we're gonna have
Thank
to
you.
do that. Give your administrative report.
Okay, in the third quarter of FY15, we increased our census from 143 to 149.
That's really high. I'll tell you, last year's 120, so it's really
Yeah, it's actually
pretty
been
full.
quite a bit better. A lot of work to get that done, and we've pretty much maintained 149, 150 since then. We hired a new admissions director, and she rocks. She's doing a great job.
You got veterans listed there too.
We do, we have, let's see, 32, 33, 31. We average just about 33. We're licensed for 40, but space and staffing in 33, 34 is really our maximum right now. So.
And I hear that there's a new DON of that unit that's doing really well.
So we have a new DON from Grant County, and she's doing doing a great job.
Right. That's good.
And then in Yucca Lodge, our census stays pretty steady around 9 or 10, and all things are going well there as far as that goes. I don't have the information on the waiting list for Yucca Lodge, but the long-term care, there's usually a handful, and we usually have someone in the queue, always have someone in the queue.
Right. Not many as year last year though. It was a lot larger number than the waiting list last year.
And, well, there's some area in marketing, I'll talk about that later. So in our projects in construction, we're getting ready to get our kitchen floor and a wall in there repaired. The original construction didn't quite fit things the way we needed them, so we're going to be working on that this summer. We're working on plans to have our kitchen run out of one of the local schools, and they're working with us very well. It's a great collaboration there, so.
Michael Browning will be here this afternoon, so he's going to go over these projects.
He's been very helpful, and Frank Flanagan from GSD and Sherry Keith have been very helpful too. Okay, point-click care, our electronic medical health record, we're implementing that now. We actually started finance April 1st, and it's busy and rocky, but we love the system. It's working very well. The clinical side of things is going through 3 or 4 phases, and we're moving right along, working on our assessments. And I'm not sure when they'll be finished with that, but it will be before the start of the new fiscal year. The old Fort Baird Hospital, we're finally going to say goodbye to it. There's an RFP that was issued in March for the demolition.
We've done demolition everything, or
Just the main building, historical buildings around the housing.
the rest of it will be still there?
Yes. So we'll still have tours for the Historical Society to entertain, and they have some great events there. And the schools participate, so we're glad to see that those are staying.
Good.
Our strategic plan, we're working on that. We've got 3 main goals we're moving forward with. Number 1, to create and maintain a culture of safety. Number 2, to transform our workforce, workplace, and work systems to ensure Fort Baird Medical Center and Fort Baird State Veterans Home has the skills, experience, and tools required. And number 3, to evaluate and prepare for needs not currently met by other providers for long-term care requirements in the state.
Can I ask a question about that? I know we have the CDU unit in Yucca Lodge. Do we have the potential to do medical detox if we have there? And is there a need for that?
There is a potential. It would take additional staff and quite a bit of a new project, but there's definitely potential.
Well, the beds are different, the rooms are set up a lot different, they're more intense, separate rooms. See how it's been asked many times.
There was kind of the backside of the new Fort Baird was actually preliminarily prepped for an addition in the future. And there was some early on discussions a couple of years ago to what that addition would include. And we did look at some more acute services, med detox, LTAC as a potential thing. So going forward as part of being able to address these needs and concerns, LTAC is the more acute long-term care service. We send so many people either out of state or other areas. So
that's why down in Roswell, in the southeast part of the state, we'd like to have that also. Just, right now, pretty much Albuquerque, so we can move forward, which we're pretty confident we can in the summer, for medical detox in Roswell. It'd be nice, the other part would, ideally want covered down in your area in the southwest, if that's possible. That would be great.
those three teams meet every week. We have a management analyst that ensures that we meet every week. She's great. She's a real driver. We're lucky to have her. So, she's also creating a Vision 2020 one-page newsletter that goes in our paychecks once a month. And she's got it. Her mantra is always okay to ask, and if not now, when.
Well, that's something for us to know. Yeah. Always okay to ask.
And she has a lot of experience in strategic planning, so she's been a great tool for us.
What's her name?
Diane LeBlanc.
Good, we'll transfer her. Well, we'll,
Okay, so our personnel vacancy and turnover, our vacancy rate at the end of March was 10.22%, with 285.5 positions filled, and we have 318 budget positions. And the turnover rate is 5.6 for the second quarter.
yeah, your vacancies are very low too.
We've done a better job of retaining and recruiting, and we're still looking for more ways to do that.
Right.
Everyone that wants to stay. So we want to convince them to stay.
Well, I do want to just kind of make notes of that, because I have heard a significant reduction in turnover. The retention there is really good.
Yeah, it's very good right now. Very good right now.
We successfully hired various positions from food servers, janitors and cleaners, nurses, CNAs, cooks, purchasing agent supervisor, and another purchasing agent, a social worker, medical records and health information tech, an office clerk, and a recreational therapist supervisor. And HR is always trying to conduct different events and attend things, and they've gone to the College and Career Day at Colburn High School, a Career Day at Silver High School, and student luncheon. Well, actually, our director of nursing, the HR director, hosted a luncheon at EAC, Eastern Arizona College in Bastrop, Arizona. We've worked on the closer universities, now she's branching out a little further than they are. The CNA class, which we hold about every 2 months, we graduated 9 students in February, 5 in March, and then the next class is set to begin April 27th. And I think we'll have 10 now. As part of our retention and recruitment, or retention I should say, we have our Above and Beyond program, and there were 26 employees recognized for going above and beyond, showing acts of dedication, kindness, caring, and support that are above their regular duties and responsibilities. So we announce those each morning, new ones at our stand-up meeting, and those go out to the whole facility for minutes. So we try to make sure everybody congratulates them, thanks them for going above and beyond. Our surveys, which we are currently in the CMS survey right now, which is
This week, right? They're happening today?
Today is our 4th day there, so hopefully they're just about done.
Right.
Okay, we did have the Joint Commission mock survey in February. We identified some areas we need to work on there, and we're working on them daily.
That's a big thing to, you're gonna take a deep breath and go for it with Joint Commission and become accredited.
Okay, and as I said, we're working on the CMS survey right now, and the VA survey we anticipate coming maybe May or June. And let's see, submitting the application for Joint Commission will be done at
Dorman will all be there, I'm sure.
Oh, yeah.
Okay, in marketing, we're strategizing to increase our community and surrounding communities outreach to promote the services we offer. We have our admissions director working on marketing with different facilities throughout the Southwest to let them know that we have beds and we'll talk to you. So we're working on our marketing. Operational updates for finance. We're working on our FY16 budget preparation every day. So we're just about finished with that. The average daily census at Yucca Lodge. This whole next section is Yucca Lodge. It's an inpatient ASAM level 111.3 residential treatment program. They're licensed for actually 16 beds. Sorry, Kathleen, it says 14. but we're actually licensed for 16, although we don't typically have that many on site. Sometimes it inches up that way, but just as people are rotating. 10 dozen for males, 4 for females. The average daily quarter census was 10 and a partial person. The previous quarter was only 7. There's 57 scheduled admits, only 43 were actually admitted for various reasons there. The length of stay is usually from 4 to 12 weeks. 4 weeks is the most common. Sometimes people stay for 3 months. The average being 26 days. So they implemented a portion of their curriculum. Their monthly billings total $13,000. For prior clients, a lot of them make payments for months and months after they're out of their treatment recidivism. And the program manager is met with Grant County Drug Court to discuss new admissions processes and how to better serve the community. And I think that has to do with Northern leading the community. So they attended 3 sweat lodges this past quarter.
Did you sweat?
If you've never been to one of those,
Sweat.
it's pretty interesting. Okay, they had 2 interns from WNU this semester. We try to have interns from Western in various departments at Fort Bear and staying close with the community and hoping to hire them afterward. They went to work day at Camp Thunderbird, which is something they do every year. The challenges, limited space needed to provide programming, and the current staffing consists of a program manager, clinical supervisor, 2 substance abuse counselors, and 6 psychologists.
Okay. Well, maybe we'll have our next board meeting in the sweat lodge.
Yeah, okay.
So very fast. So any questions for Kim on Fort Bayard?
I would just like to add that there's 32 on the CDU waiting list, and the other thing is, no, you can't have Diane.
Oh, sorry, no, you're not. Okay, sure, thank you. So I'd like to ask for a motion to approve all the administrative reports as a group.
I make a motion.
In favor?
Second.
Aye. Opposed? Okay, passes unanimously. And we're going to move, Shawnee is here representing, Shawnee and Drew are both here, representing finance today. And Shawnee, did you want to do the Program Area 6 financial report?
Okay, it's the last page of the booklet.
Right after the last administrative report? Well, no, it's the financial report. Okay, well, go ahead, we'll jump ahead to that after that's pretty soon.
I'm sorry.
Right behind that.
So for FY15, the facilities right now is projecting to receive or earn $137.8 million in revenue, and the operating costs are at a $144 million. So essentially, we're looking at a $6.3 million deficit. But we are looking, the management, facilities management has been looking at every, avenue to look at, the hiring, schedules, overtime, operational processes, reducing costs, for supplies, any costs they can reduce just to help out with the deficit. A lot of the deficit came from the 3% salary increase and GSD rate increases in personnel costs. And so we did ask for a supplemental request of $6.4 million. We did not receive that, and so during the executive, $1 million was recommended for the supplemental, but we did not receive that as well. So right now we are still trying to find, I guess, all the opportunities within the facilities to see if we can reduce some of these costs, the $6.3 million deficit. We're looking at bringing in a bar of about $2 million, and that should reduce the deficit down to $4 million. But also we're looking throughout the agency as well to see if we could, assist facilities with funding as well from other program areas, and we did get our language for that. But we're not sure how much each other division within Department of Health would be able to assist facilities.
Right. Well, we spent this afternoon here from 1 to 4 having a facilities meeting and working together as a team this afternoon and talking about the initiatives we have in place right now for both revenue enhancement and expense reduction. So it'll be from 1 to 4. There'll be a calling number for that, but the finance directors and administrators will be here in person. We'll have a good session, I'm sure, this afternoon. Anything else, Sean?
Just that everybody is working closely with Drew and I they're working on their FY16 operating budget, and so the budget for facilities is flat with FY15. So there was not an increase in budget, but we're looking at hopefully, with the new processes for billing and collections, that we can bring in an additional $4 million in other revenues so that, we can be able to maybe possibly break even in FY16.
Right. All right. We have a lot to talk about this afternoon.
Yes.
All right. Any other questions? Shine? Okay. Make a motion to approve the Program Area 6 financial report. All in favor? Aye. Opposed? Okay. Now, Dr. Dorman, how many policies do we have today?
Well, we have a lot. We don't need to go over all of them. That's everyone probably got included that really did need to be there, that do not require board approval. But the policies that we have are behind the presentation in the report. Accreditation does require some policies to be approved at governance level, and those are policies that would affect the general operation of the entire facility. Some of these local policies, like so we can approve these by consent agenda. I mean, if anybody wants to take a look at any of these specifically.
Is there PHI?
Yes, I believe they're all
PHI, veterans zone.
Troy, did you have any comments on your PHI ones?
No, they were reviewed by legal. When we do, given that we have such a large volume of policies, we send up this index list, as you can see, with any changes that were made after we've reviewed them as a policy committee.
Any real substantive changes, more just
the one that's really significant is on the, I believe it's the 4th page of the policy list, policy clinical services 084. And I just probably want to let everybody know what that was about, because that's really important. There was a policy in place that permitted 2 providers to declare a patient as a do not resuscitate patient. And we did some checking into that. That was the way it was. And so we decided, after we doing some checking, that was probably not appropriate for physicians or other providers to actually make that declaration. They could certainly make the declaration that the patient was terminally ill and would not benefit by resuscitation, but the decision not to resuscitate should come from the guardian or from the patient themselves. And so that's what we did. We made a policy change. Legal approved it. I think we're all a little bit happier with that, because doctors and other providers really don't want to take that responsibility anyway. So it was a really good change that we made, because it was came up with that decision. So those were the only significant.
nothing else, no other substantive changes?
No, none of the other. There's substantive changes.
There's quite a few there. Right. We'll do them all, I guess. We'll vote on all three, but next one I have on my book is veterans home. Next one I see in here, Dr. Dorn, is proposed policies for the veterans home.
These policies are local policies, probably, in fact, they do not require board approval. They're just infection control policies. I've been over these. They meet national standards for infection control, and really done, and this is, Joint Commission makes this requirement so that those that are governing the hospital really do know what exactly is going on in the facility. So this is the NMRC Annual Performance Improvement Report for 2004.
Right, that's good.
The emergency management plan is right behind that. That is a required report that governance needs to see.
For Roswell, too.
For Roswell, and that is basically what happens in the case of a community disaster. With a plan, and if we're going to receive patients in the event of a disaster, Roswell, the rehab center really isn't capable of receiving a patient from a community disaster because we don't have supplies or equipment to take care of these. But we can house the less injured patients that need minor care. We do have to have sustainability, and so that's all discussed in there. The performance improvement plan behind that one is the result of what the 2014 plan was. We evaluated it, and then for 15, this is what we're planning to do. That is also a report that is required to be presented to the governing board. And so the governing board is aware of what is going to be planned in the future. And I believe that ends the policies.
No, these are all.
Okay. Great, I'll make a motion to approve the policies as approved, all together.
Motion.
Second.
All in favor?
Aye.
Opposed? Okay. Going to look to the back, that page, you have a one-page,
One-page summary for the credentialing
well,
report.
that's before the policy.
It's just reported, it's a kind of a spreadsheet.
The one this sheet here,
Right.
that's, looks like a,
Correct. Also, in your handout packet, the last page.
One of the things, kind of a little summary of what's been going on in the medical staff office, that we have managed to just about catch up with all of our providers in the public health division, and get them all credentialed and privileged. You'll notice on this list that we only have one provider, who we had to process. Unfortunately, she was terminated, prior to, being able to be, privileged. So that was a decision by PhD, and they notified us. So that file does not require approval, so we're taking that out of the list. We've also had some reason to think that we might need to start credentialing physicians in the epidemiology and response division. Probably just a good idea as we're looking at our own processes, making sure we're doing a good job, getting all the information that we can possibly get on any provider who's applying for a job within the Department of Health. But that's to be discussed, that's going to be determined in the future. So right now for our appointments and reappointments, starting at the top with Turquoise Lodge, we have a reappointment for two of our physician assistants. Both of them are outstanding providers, Kelly Romero and David Helgeson. At Sequoia, we have a new appointment for Dr. David Durham. As Brad said, he's an exemplary provider. I think he's going to be a really true asset to our staff there. He relates well to the residents of Sequoia, and I think will be terrific. Under State Veterans Home, we have three providers, Dr. Ed Janetsko. There's a misspelling there, we'll make sure we get that one corrected. Edward Janetsko, he is our medical director there. Greg DeMore, who is our pharmacist, but he's also a pharmacist clinician. So he is actually managing patients as well. So they're two of our invaluable providers down there. Margaret Aguilera is an independent social worker, and she needs to be credentialed only. She does not need to be privileged. At NMDOH, we have a list, as we usually do, of providers there. Abeta, Timothy Valentine, William Burkle, Simone Viljoen, Diane Saras. A little bit of Dutch. Right. It's actually Afrikaans, but that's okay. Minor difference. Diane Saras, Renee Soderman, Nathan Andrews, Cynthia Williams, Carol Ernst, and Sean Killeran. All of these providers have had no unusual activities and no outstanding features in their credentialing packet. At Fort Bear Medical Center, a new medical director down there, Massam Al-Homsi, Pradeep Shankar, and Michael Harris, nurse practitioner. And at Mexico Rehabilitation Center, Teresa Williams, who is a new addition, Master Social Work, Stephen Black, who is both a psychiatrist and a board-certified internal medicine. He serves double duty and works double shifts. And
is there a box that should be checked for him?
Yes, he should be a reappointment. And Rhonda Gutierrez is an initial appointment. She is our director of the IOP program. All of these providers have nothing significant on their history or credentials files that would in any way prohibit them from being privileged, credentialed or privileged within the Department of Health. So I'm recommending the approval of all of these providers as a group.
Okay. I request a motion to approve all the policies as approved.
I make the motion.
Susan Summers?
Susan
Yes.
Summers?
You didn't mention her.
She's been pulled out.
Okay, that's the one.
This was a report that was from the NEC, and since she's no longer with us, she can't be privileged, so.
Yeah. All right, so I made a request, the motion is made and seconded. All in favor?
Aye.
Opposed? All right, we're getting toward the end of, before we go in the closed session. Announcements, our next governing board will be in May. I don't know if there's any suggestions. Usually that means in summertime, it's usually Fort Bayard or Las Vegas. I don't know if any board members have a preference where they'd like to meet next time other than the Sweat Lodge. Or July, yeah, they say July, I'm sorry. In July, it's usually a good time to go north or down to Fort Bayard. Anybody have a preference?
I mean, maybe an opportunity, because I know we've done a lot of the other facilities, but maybe Fort Bayard is the annual.
We tend to go there in the summer. Tends to be time to go to Fort Bayard. Weather's good. So it'll probably be there. It's usually the third Thursday of the month. So
23rd, no, the 16th.
about the 16th, then. That'll be a tentative date for the next meeting in Fort Bayard on that Thursday at 10 in the morning. And it's always nice after a great day for a tour of beautiful facility. Just any comments? Anybody like to make any opening comments or public comments or anything? I'm not sure if it's just Kathleen on the phone or. Okay.
I'm still here. The only problem with Fort Bayard in July is our kitchen floor, but we could work around that.
Okay. Well, we won't go in your kitchen, I promise.
Okay.
All right, then if there's no other comments, I ask for a motion to adjourn to close executive session.
Motion.